Hi, everyone. Thanks for coming out tonight. So we will get started right now. Thank you for joining us for our second general meeting.
Okay, so here's the agenda. So we'll first do some announcements, and if we have time for an activity, we'll do so. But if not, then we're just going to get in right to the topic and welcome Alfonso Vega. And on that note, we do need to remind you guys to pay your dues. So it's $10 per semester or $20 for the entire year for ACSF. We don't have a GPA requirement, but we do require you guys to attend at least 3 events. And speaking of graduation sessions, which we'll get into later, you guys do have the option to purchase one.
For UPD, the dues are $10 per semester or the $20
Greetings,
lifetime.
everyone. It's very quiet.
Hello.
Hello.
Hi.
Hi. So there's
Hello.
the $10 per semester membership or the $20 per lifetime membership. And
Dr. Martinez, can you hear me?
We can hear you, Dr. Lawrence. I think you might have everybody, your headset's not working because they're talking now. Can you hear me, Dr. Lawrence?
I can hear you now.
Okay,
Thank
we
you.
got it, girls. Carry on.
Thank you.
Okay.
Okay, all good. And then, so for UPD, there is the 3.25 GPA requirement. And then there's also for graduating seniors who are in UPD, you can purchase a graduation cord or tassel, which we will get into later in the presentation.
Okay, so we originally had the graduation interest form deadline to be today, but just in case anyone missed the form, we extended it to next week, so a week from today exactly. And we have a couple new questions on the form, so we really advise people to redo it if they can. And the QR code is on the screen, so you guys have easy access, but I think we'll also be posting it in the chat. But we are preparing to order the sashes and the cords. So within the next few weeks, we'll probably have a order form ready for you guys to officially make orders on that. And we want to advise you guys, in case you guys want to have your order shipped to your house, you are responsible for paying for that. So we really recommend you guys come on campus to get the sashes so you can avoid those fees, and then also just get the sash early on. And yeah, that's pretty much it for the announcements for the graduation sashes.
If you're just curious as to what they look like, we have them posted on our flyers on our Instagram.
So everyone, we are considering possibly having an in-person end of the year celebration for spring 2020 HCA graduates. But in order to decide whether or not to have one, we need to have interested students. So please, in the same form, the interest form, just answer to the submit an answer to the appropriate question. So we know you guys are interested to celebrate. So, you know, just know that that's something that could be a possibility.
Then we are opening our interest form for the 2022 and 2023 board elections. So if you're wanting to get some more leadership experience, interested in building your relationships and networking, we would love for you to fill out the interest form for a board position for next year. And the deadline for this is April 6th, which will also be our election information night if you need more, if you would like more information about the board positions. And so that leads us into our upcoming events. So Wednesday, April 6th at 7 is our board election information night. And then our second event in April will be on Thursday, the 14th at 3 to 4 p.m. And we are collaborating with the California Nursing Student Association with this, their chapter at Cal State Long Beach. And we will be having a guest speaker Ms. Teresa Murphy, and she will be discussing a day in the life of a chief nursing officer.
And lastly, here's our socials. So for HCSF, it's just HCSF, and for UPD, it's CSULB UPD. And our Discord channel link will probably be posted in the chat soon. I know you guys can't really click on it right now, but we'll post it in the chat so it's easier for you guys. And we do have time for an activity, so I guess we could do that. Okay. Do you put people in breakout rooms, Tina?
Yeah, I can do that.
Okay, it'll be like 4 minutes. So we just want to know what you guys are, let's see. The question will be what you guys are looking forward to learn tonight. So our topic is careers in nonprofits. So you guys can discuss that and what you guys would be interested in learning for that.
So I will create the breakout rooms right now. And,
All right, everyone, welcome back. So now it's the moment you've all been waiting for. I'm proud and happy to present the Vice President of Health Services Administration of AltaMed and Vice President of the HCA Advisory Board, Mr. Alfonso Vega. Thank you so much for being here.
Thank you, Jose. It's a pleasure. It's good to see you too.
Likewise.
All right, so is someone going to queue up the presentation for me? Awesome, thank you. So good afternoon or good evening, everybody. Alfonso Vega, VP Health Services. I've been with AltaMed for 12 years now. I'm currently serving as Vice President of Health Services Administration. What that means is I oversee our behavioral health, our dental, HIV, health education, and radiology safety divisions within AltaMed. I've been in healthcare, it's gonna be 40 years next year. Started as a medic in the Army, eventually became a medical assistant, eventually became a back office supervisor. But once I became a back office supervisor, I had to make a choice whether I was gonna go down the clinical path or the administrative route. And within that time frame, I became a office manager, and I saw what clinicians were making compared to what administrators were making, and essentially that if the clinical path was one's passion, one's vocation, if you will, that it was worthwhile to follow that, but there was a plateau as far as career growth, as far as salary growth. Hence, I chose administrative, and we're going to talk a little more about that throughout the presentation. So I've been managing clinics for a long time. It's what I plan on doing for the rest of my career. And I hope to give you tonight a little preview of what it's like to work for a nonprofit. I work for AltaMed Health Services. If you don't mind going to the next slide, please. AltaMed Health Services is a federally qualified health center. Anybody know what an FQHC is? What an FQHC is, it's a federally qualified health center, but it's essentially a community clinic. Back when I was your age, there were no FQHCs or community clinics. Hence, people that were either underinsured or uninsured, rather than being able to go see a primary care doctor that either only accepted cash or insurance, they would use the emergency room as their primary care office, if you will. And it was sad. I remember honestly of patients telling stories of how they would wait at County USC within their emergency room, sometimes for up to 2 days to see a doctor. It's an injustice, it's a disparity. However, if you look at it from the economic standpoint, it's also a tremendous waste of resources. If you consider modern day average emergency room visit runs anywhere between $10,000 to $50,000 per visit. Imagine just for a runny nose or sore throat, being worked up for $10,000 worth of services that you could not afford. Because even though you're seeing an emergency room, regardless of your ability to pay, you still get bills. You still get put on collection notices and so forth. Hence, President Reagan's administration had the foresight to create FQHCs, where essentially anybody and everybody can be seen regardless of their ability to pay. It's not a free clinic. There's charges that are generated, but we don't send people to collections, and everybody and anybody is welcome to be seen there, again, regardless of their ability to pay, with the whole idea that if we keep the community healthy, the expensive resources are left for the people that really need them, or better yet, the emergency rooms are left for people that are having heart attacks, strokes, etc. And the runny noses, sore throats, and lumps and bumps can be seen in a primary care clinic, which is essentially what we do. So first thing that I'd like to impress on all of you is if you're considering a career within a nonprofit, really what distinguishes a nonprofit or a community-based healthcare delivery system from any other system is their mission. And most importantly, a leader's, or even the staff for that matter, belief in that mission. Jose, you've had quite a bit of experience interacting with AltaMed staff. There's very few people that work within our organization that aren't only mission aligned, but are mission embraced. But most of our staff, if not 60 to 70% of them, were born and raised in the communities that we serve. So incredibly mission aligned. I'm not going to read the slide to you slide by slide. Honestly, I know our mission well enough where I can recite it to you with my eyes closed. But really the key parts in here is we firmly believe that we exist to eliminate disparities in healthcare. We feel that patients in Newport Beach, patients in Palos Verdes, and patients and places like Beverly Hills, they have a real high level of care, and they have the real high-end hospitals. We firmly believe that patients in East LA, patients in the St. Mary's area of Long Beach, patients in Santa Ana deserve the access to the same level of care as patients in those affluent areas. And it's organizations like AltaMed that work very, very, very hard to do that. When I was a kid, my parents were I'm a first generation Latino or Latinx whose parents immigrated when they were young adults in the United States and didn't have insurance. I used to get my immunizations at the health department because there were no FQHCs, and literally have to spend an entire day there just to get a tetanus vaccine. So I lived the mission that we honestly serve and was a member of that community. We're a social justice organization from the perspective that we don't believe that healthcare is a commodity or a resource that only certain members of within the socioeconomic status should be afforded. We believe it's a basic human right to have access to healthcare, and we work very hard to take care of people that fall within usually 60% of the communities that we serve are at 250% or higher than the federal poverty level. And that's making not so much money and barely having enough money to put a roof over your family's head and food on the table. Which leads to the next part of our mission statement, which is we strive to become an integrated world-class delivery system. We want to be the Nordstroms of healthcare. And you'll see if you look through our core values, really what we strive to be is an integrated patient-centric organization where we're focused on the core relationship or the core competency of any healthcare agency, which should be the relationship, which should be doctor-patient relationship. The core of everything that we do is predicated on relationships. If you ask me, what's manufactured at McDonald's, it's hamburgers, right? Within healthcare, we're in the relationship business. We're only as good as the last encounter we had with the patient and the probability of them choosing to come back and see us as a doctor is based on that relationship that we established with them. Next slide, please. This is a quick heat map, which shows where all of our 50 plus locations within AltaMed are located throughout Los Angeles and Orange County. And there's a diverse amount of careers that are offered within. There's close to 30 medical and dental clinics. We have our own pharmacies within. There is a program which is known as Program for All-Inclusive Care for the Elderly. A lot of us have aging parents, aging grandparents. And I think one of the worst things that can happen to a person that's in their golden years, if you will, is for the freedom to be taken away, to be institutionalized or placed in a skilled nursing facility. Program for All-Inclusive Care for the Elderly, or PACE, is just imagine a unit or a clinic where you can go spend the day, receive all the services that you would receive in a skilled nursing facility, but get to go home at night. And be maintained as healthy and as independent as you possibly can for years and years to come. We also have a mobile health unit that's focused on dentistry, and another one that's focused on preventive health. You see the color coding inside of there. The darker it is, the poorer the area is, or the higher the poverty level. So key thing you point out is you see we're in the most underserved communities throughout Southern California. I'm gonna pause for a second to see if anybody has any questions regarding AltaMed before we start talking about leadership within AltaMed.
Well, I have a question.
Please, Harold.
So you mentioned that you know, there's a lot more freedom when it comes to the elderly and everything like that. But what about dealing with you know, patients who have long-term conditions such as epilepsy, for example? How would your would your pharmacy be able to you know, not contribute, but help them?
Now, I think the audio, yes, the audio went out.
Okay.
You can hear me now? All right.
Yeah, we can hear
Yes.
So Harold, you had a question.
Right. So how would AltaMed deal with you know, people who have you know, long-term or chronic conditions?
I can see your square lighting up, but I can't hear you.
Oh,
Can everybody hear me?
you. Yeah.
Yes.
Oh, weird. I can't hear any of you, but I'll keep going through the presentation, see if the audio comes back on your end. Do you mind going to the next slide, please? Awesome. So I am a huge Jim Collins fan. Has anybody ever read the book Good to Great? If you haven't, I highly recommend it. It's a great business book. But Jim Collins came up with a concept that he felt that organizes every organization. I'm going to talk to you a little bit about as far as how it pertains to a nonprofit organization. And he called it the three hedgehog circles. Specifically, what one is deeply passionate about, what one can be the best in the world at, what drives our economic engine, which is all unified by what he refers to as a BHAG, or a big, hairy, audacious goal. The goal that we have as at AltaMed as a BHAG is becoming the best. One thing we realized is as a nonprofit, we're no longer competing with other small community-based clinics. We're competing with the Kaisers of the world, the Providence Health Centers of the world, and we strive to become as efficient, as quality-driven, as patient-centered as they are, if not better one day. Next slide, please. So first point, what can you be the best in the world at? We strive to be the best at delivering on our promise that we make to the communities, which I shared to you at the beginning of the presentation, which is our mission. Next slide, please. Question that I have for each of you and that I ask anybody whenever I'm doing interviews. Why did you choose healthcare? How about if someone writes it in the text, since I can't hear any of you? Any brave souls out there?
Well, I see a bit of a disparity between the Canadian healthcare system and the American one.
Why did you choose a career in healthcare?
Oh.
Well, I asked that question. Oh, there you go. There they are. So let me read a couple of the answers. I chose healthcare because I want a career where I can give back to the community. That's a great one. This is another one that's really important too. Healthcare will never become obsolete. Healthcare and education are the two career fields that are recession proof. There's always going to be demand for both healthcare and education. I want to improve things in the community. That's great. And Harold, I saw your question from earlier, and I'll get to it right after we get to this point. And healthcare is very diverse. It has a lot of opportunities. Karina, I agree with you. I'm going to tell you, as you're starting to learn to work with healthcare folks, as you become leaders within the healthcare industry, to focus on relationship-based questions. The people that I tend to hire, that I tend to really be intrigued with, are the ones who can tell me a story of a person that they deeply cared for that became ill, or an experience they had in their beginning of their career, in the beginning of their career in healthcare, in which their intervention, their value added made a big difference in somebody's life. Circling back to the original point that I made, that we're in the healthcare business, or excuse me, in the relationship business. And ultimately, our ability to deliver on the commitments that we make to those relationships is what distinguishes professionals within the healthcare industry that are successful and ultimately lead the way for everybody else. Harold, I'm trying to find your question again. How is it that we care for folks that are chronically ill and have long-term illnesses? There's very complex systems that help drive that. Healthcare is changing. When I started in healthcare 30 years ago, everything was a fee-for-service model, or essentially where you came in to see a doctor, you billed out a certain amount and you got reimbursed at a rate that either you billed out or that CMS or an insurance company stipulated. And pretty much every time you saw a doctor, you got paid. Preferred provider organizations came into the equation, where they started paying a percentage of what Medicare or the CMS establishes therein. And thereafter came in managed care organizations, which pretty much changed healthcare as a whole. Case in point, and to answer your question specifically, Harold, we've gotten very sophisticated at how we manage how sick people are, specifically where there's diagnostic coding, there's risk adjustment factors. I don't know how much you've studied this in school, but based on the diagnosis and the documentation that a provider puts in a chart, we can assign a quantitative amount as to where the resources need to be. Case in point, people in that PACE program that I alluded to earlier have to have a risk adjustment factor that's up over a minimum threshold and have to have several comorbidities, where routinely, if they weren't enrolled into the PACE program and had that high level of care, they would be admitted and readmitted into a hospital system over and over again. Hence, eventually being put into a skilled nursing facility and having some of that freedom or liberty taken away, which is a prized thing for folks that are in their golden years. So moving back to the presentation. I worked for Caremore Medical Group for quite a few years, and their former CEO said something that stuck with me that I like to say is people before profits and profits will follow. Case in point, we're in a relationship-driven industry, and if you focus on delivering value, integrity-driven relationships, profits usually follow. And the key thing you got to remember when you're talking about healthcare is we're a choice-driven industry. Case in point, you choose to come to work or come to school every day, but our patients as well have every right to vote with their feet. Case in point, they don't get the care they receive. The integrity in that sacred doctor-patient relationship is compromised in any way, shape, or form. It's really easy for them to pick up their phone and choose another provider. If they're on the Medicare side, sometimes they have to wait a year, but they're also very capable of choosing another provider or even another medical group. So understanding the power of that choice is incredibly important, and being very, very passionate about the importance of relationships within healthcare or nonprofit community medical groups is incredibly important as well. Next slide, please. So career tracks that you can choose within healthcare, specifically with a nonprofit organization. What is it that you can do to transition from an academic career to a professional career? I work in operations. Operations has profit and loss responsibility, where we oversee a revenue generating business unit. There are careers within finance, specifically making sure that we remain solvent for years to come, that we plan financially and fiscally on a monthly, quarterly, annual basis, or for years to come when it comes to strategic planning. Another significant aspect within specifically nonprofits is compliance and risk management. The federal government funds a significant percentage of the revenue that we generate. So we have to stick to the guidelines, regulations, but most importantly, national patient safety standards to ensure we afford the highest level of care. Some of you may choose careers in analytics, where you're taking data and converting into something meaningful that will tell physicians that they're on the right track, tell executives the direction the company's headed in. Project management's another career that you can choose that isn't unique to healthcare, but IT projects within healthcare have project managers assigned to them. We're doing quite a bit of mergers and acquisitions, which are very, very complex projects that we make a promise to a organization or a group of people within that organization that we're going to integrate them into our organization within a defined period of time, and a project management plan is critical to that. Fundraising. As a nonprofit, there's people who want to invest. There's organizations that want to invest. The federal government makes a lot of investments within our organization to help lead our cause. As I mentioned, we're not a free clinic, but there's a lot of services that we offer that might not be covered, but that we need to find funds for to be able to take care of. I'll give you an example of a grant that we've received within the scope of the recent past. There's a lot of, as a result of the recent pandemic, our behavioral health, the behavioral health division has become incredibly busy, where it takes almost a month to get an appointment with a behavioral health clinician. We've received grants specifically where we can take students that are in social work programs and psychology academic programs and have them start to see patients to help us get a little caught up or help with the crises that are going on within the communities that we serve. There's grant management, which falls along the lines of fundraising as well. Specifically, once we're assigned a grant by the government, it's kind of like a contract where there's rules or stipulations, there's reports that need to be made, there's financial metrics that need to be followed, where we have grant managers that assure that we remain compliant with the promise that we made to either donors, lenders, or the federal government for that matter. At AltaMed, we have grants from the federal government, CDC is who comes to mind, the state of California with the county of Los Angeles, the county of Orange, all geared towards eliminating those disparities. Another track that you can choose is clinical. Tremendous opportunities with that. You know, the one that comes to mind that's in high demand right now is behavioral health. It's growing and expanding significantly. Nursing's another career that pretty much you can do anything you want with. You can start doing a clinical track, but I have a lot of executive colleagues that have decided that they want to lead. A lot of friends that started in nursing that now teach, or that risk adjust, or that case manage. Just the diversity is tremendous from that perspective. Other careers that you can consider within healthcare are along the administrative track, or specifically managing human resources or supply chain. Informatics is another road that can be followed. Communications and branding is another one. I'm going to pause for a second for questions. I'm sure there's a lot on this slide. Now I'm going to go to the chat because I can't hear any of you. So Mariah, I see your question. As a nonprofit working under the government, would you say that current geopolitical instability with the war in Ukraine is affecting your budget to provide care? It is not. It is not. A law that was signed by President Biden, or the American Rescue Act, not only strengthened our position to continue to render care, and it wasn't just for nonprofits, it was for industries across the board, but quite a few billion were allocated specifically for healthcare, for behavioral health expansion, for Medicaid expansion, et cetera. So it has not impacted healthcare, at least not to date. Any other questions that want to be sent out in the chat? All right, let's go to the next. Oh, here we go. Has AltaMed used grant money to fund research? Absolutely. Within AltaMed, we have the Institute for Health Equity, which focuses on research. We have 2 PhDs that are consistently looking at statistically valid or scientific methodology on how we can eliminate disparities or bridge those gaps, socioeconomic gaps, for example, with food insecurities. In AltaMed, we actually have a family practice residency within our Southgate clinic, where we take physicians that are interested in specializing in family practice, but that have a desire to give back to the communities that they were born and raised in, or some that just want to work in underserved communities. So quite a bit of research is done through that as well. We partner with Charles Drew University from that perspective. Quite a bit of research in partnership with UCLA and USC. We partner with the School of Nursing on the UCLA side and the School of Social Work on the USC side, and with Healthcare Administration at Cal State Long Beach. All right, next slide, please. So key thing I want to talk to you about is the difference between leadership and management. A lot of folks, when they choose that operational track or that leadership track or the executive track within a healthcare organization, aspire to become managers. There's a big difference between management and leadership. Management's about process, it's about analysis, it's about results, but it's about getting from A to Z and what it takes to get there. Where leadership, on the other hand, is building a culture, establishing a culture within an organization. It's our ability to influence other people to do the right thing. It's about developing folks that you work with. Every successful leader is always developing their replacement. It's about mentoring people, envisioning the leaders of tomorrow, the professionals of tomorrow, and giving them the tools and the resources they need to get there. Next slide, please. Some things you want to consider are skills that you want to consider as you're pursuing careers in leadership. One of the things they can't teach you in a university is political savviness, or learning how to navigate your way through complex political situations. And a lot of that's just, it's honestly learned through doing it. Being effective, knowing when to be effective, but also when to just sit and listen. Understanding the sensitivity of a culture throughout an organization. I can tell you, culture throughout organizations varies. There's organizations that are very growth focused, very bottom line focused, and other organizations that are centered around their mission, like AltaMed, and choosing what works best for you, but most importantly, understanding the type of organization you're in and working to align yourself with that culture. There's corporate politics are never fun to work in, but they're necessary to get things done. And understanding that, I think, is paramount to being successful in any career. Managing teams. Key thing is, if you're not providing direction or pointing your teams in the right direction, your organization in the right direction, which for us is all about mission alignment, it's easy to go in circles. Setting goals that are stretched, or better yet, that are challenging for people to fulfill. I can tell you that within the scope of the last 6 years, AltaMed has literally doubled in size. We've went from about 150,000 members, where we're close to about 400,000 members now. There's been a lot that drove towards that, but us strategically planning to grow with all of the benefits that came from the Accountable Care Act were conducive towards that. Being very clear in your communication. It's easy to get along with someone, but it's not as easy to disagree. And learning to disagree constructively is incredibly important when working with diverse teams, but most importantly, organized teams. Next slide, please. So economically, how does a PPS work? Excuse me, how does an economic engine work? And the first word that comes out of my mouth is PPS, or prospective payment system. What makes us a little different than most organizations, we talked about capitation earlier, and most of you have already studied this. Most organizations get a PMPM, or a per member per month reimbursement. And some organizations even share risk, if not carry full risk. And it's how they're reimbursed for the services that are provided. What's different within an FQHC or a nonprofit community clinic is we're reimbursed in what's known as a prospective payment system. PPS is prospective payment system, Juan. And what that takes is essentially kind of the way real estate works, where they take comparative rates or comparative amounts that clinics or houses are being sold for. We take comparative prospective payment rates, or PPS rates, for other community clinics or the area, or if you're in an area where it's really underserved and there's not a lot to compare to, it's an expense-based reimbursement methodology. So in essence, when you consider at AltaMed, it takes us anywhere between about $180 to $190 per visit to see patients. And it's really not that expensive if you have healthy insured patients that have access to a full spectrum delivery system. Whereas at AltaMed, I would tell you 10 to 20% of our patients are uninsured. And we're not only their primary care physician, but also their specialist as well. Does this mean that you do not accept certain insurance packages? No, we see everybody and anybody who walks through the door, Mariah, regardless of their ability to pay. We see everybody. I would tell you about 70 to 80% of our patient population has Medi-Cal or Medicaid. There's 10 to 20 that are uninsured. There's some commercial business that we take, about 5, maybe 1 to 5% that have Medicare, but the bulk of our patients either have Medi-Cal or a combination of Medi-Cal and Medicare. The other thing that drives our economic engine is patient recruitment. You know, there's a lot of commercials that you'll see on TV for AltaMed, for Kaiser, other large healthcare organizations. But ultimately, what drives enrollment is word of mouth. You know, your next door neighbor telling you that what a great doctor I have at the Commerce facility, or what a great doctor I have at Kaiser. It's that reputation that ultimately drives. Hospital affiliation has a lot to do with it. Aligning yourself with the highest quality hospital systems in the area, which we take pride in doing. The White Memorial Adventist system in East Los Angeles, Citrus Valley Group, or Queen of the Valley in the East San Gabriel Valley are a couple examples of quality hospital. Children's Hospital of Los Angeles is another hospital that we're closely affiliated and partnered with. And ultimately, brand recognition. Once you become well established within a market, AltaMed's been in business for over 50 years. People know to rely on organizations like Kaiser, like Providence, for quality, or they associate that with quality and choose you as a medical group. So I see your question, Itzel. If someone is on a managed care plan, would they have AltaMed assigned as their PCPs? It depends. It depends if they have a managed care plan or if they have a fee-for-service plan. With Medi-Cal, which is our primary payer itself, people still have the choice of either having straight Medi-Cal or fee-for-service Medi-Cal, or choosing a managed care plan. We strongly encourage our patients to join a managed care plan because it gives them access to a full and robust specialty care network. Whereas if we're managing through a fee-for-service plan, unfortunately, there's still a lot of specialty groups that are averse to Medi-Cal, or won't take it at all, or will only take it if it's combined with Medicare. So again, delivering on our mission or our promise, it's a lot easier or a lot more efficient for us to do that when a patient is assigned to a managed care group. But you're welcome, Itzel. Another thing that drives our economic engine, you know, you've heard the expression that it's a lot less expensive to retain a patient than it is to recruit a new one. And same thing applies to employment as well. So patient retention is incredibly important. And quality speaks for itself from that perspective. And service, we invest quite a bit in resources to make sure all of our staff is trained not just in providing the highest level of service, but service recovery, or what to do when things go wrong. And ultimately managing what's most important within healthcare, or the pinnacle of everything that we do, which are relationships. Next slide, please. This is the last slide. So a key thing, and to wrap up, I think most of you have taken a marketing class, but there's the 4 P's of marketing: price, product, promotion, and place. If you look at it from a healthcare perspective, price, we can't manage that. We can't control that. It's Medicare or CMS that establishes reimbursement structure that most health plans follow, and ultimately Medicaid follows. And it's structured and fixed. There's whole coding methodologies that regulate specifically how billing is done within healthcare. Not something we can control. Product, that's also very regulated from the perspective that physicians are licensed, nurses are licensed. The majority of the positions within behavioral health care clinicians are licensed. and they have to stick to the regulations that specifically guide and drive them. Even the insurance the insurance industry is regulated as to what they can and can't do. So we got to work within that circle. From the perspective of place for a nonprofit community healthcare delivery system, we're in the neighborhoods that need the care the most, or specifically where 60% of the population is 250% or worse than the federal poverty level. So we can't really choose to where we're going to be, which leaves promotion or that choice factor that I made. And it's incumbent upon us as leaders, ultimately as an organization, to promote ourselves as the organization that delivers on our promise of quality care without exception, and that patients rely on that and believe in the promise that we make to the community in delivering the highest quality of care. So that concludes the presentation part. Now I'm all ears for questions, and I think we're gonna have to go through the chat because I can't hear a thing anybody's saying if you're talking, but I'm glad you can still hear me. Thank you, Maria. Oh, great. So what would be the difference between logistics and informatics? I'm going to date myself here, but I've been in healthcare before computers existed. Back when all charts used to be on paper, and I can remember days where a chart would get lost and we'd spend hours, if not days, looking for it. Something I'm happy to tell you is we're decades beyond that now, specifically where we utilize electronic medical records. So Eric, informatics is the management of those electronic medical records and all of the automated systems that we use to manage healthcare, or corporations for that matter. Our human resources team is on a human resources information system. Our accounting team is on an accounting database that we utilize to manage everything. So it would be managing all the IT aspects. Logistics is supply chain. We need medical supplies. We need pharmacy supplies to be able to practice medicine. So they're ensuring that not only do we have the resources necessary to care for our patients, but that we never run out of them. It was critically important during the pandemic as far as securing PPE and making sure we always had enough on hand to be incredibly efficient. So supply chain is logistics and informatics is EMR or IT, if you will. Mariah, I see your question. I know that nonprofit healthcare organizations get involved with charitable projects for the community. Which project are you most proud that you oversee? We're starting a new initiative, something that's common, not just with nonprofit organizations, but healthcare organizations. We get busy and we get busy fast. And it kind of goes back to that inelastic demand that we were talking about earlier, where there's always going to be a demand for healthcare. So I can tell you in Anaheim, we opened up a 90,000 square foot facility, and we thought, God, it's going to take us years to outgrow this. I'm telling you, we're already struggling for space there. So coming to answer your question specifically, Mariah, coming up with innovative ways on how we can extend the level of service that we offer, or better yet, deliver on the promise that we make in our mission, outside of the four walls or the constraints of the brick and mortar walls that we work within. So the one that I'm most proud of that I'm actively working on now are school-based clinics. We're going to get out in elementary schools, high schools, middle schools, and set up behavioral health clinics, preventive dentistry clinics, pop-up clinics on the medical side, where we're doing school physicals, immunizations, but not necessarily taken away from the primary care physician, but complementing what they do so they can focus on the folks that really need to be seen within the office. Think about the times you've gone for a flu shot and spent an hour and a half waiting to get that flu shot, where if you at school, you could have gotten that same service and probably gotten it in a couple of minutes. So taking our service out to where patients are at and where it's more convenient for them to be seen rather than having them come to us. I think that's a project that right now I'm the most proud of and actively working on. Move down to the next question. Dr. Martinez, thank you for your accolades. How would you recommend to get involved in a nonprofit? Ruan, I will tell you one of the great things about a nonprofit is the majority of nonprofits accept volunteers. There's always events that community members can participate, whether they be fundraising, whether they be geared towards something you're very passionate about, like citizenship drives, health drives, and so forth. That would be step one. Something I'll tell you Jose is actively involved in right now is choosing an internship within a nonprofit. I can tell you we routinely host anywhere from 2 to 3 Cal State Long Beach Healthcare Administration interns, in which we assign projects within behavioral health, dental, even medical for that matter, where you could shadow an executive, you could shadow a frontline leader and learn what happens day to day with them. And if you're interested in one of the other career tracks, you know, like IT or fundraising or something along those lines, we could arrange a internship within those departments as well. So Harold, you're asking about the mobile units. So just imagine a big motorhome that's rather than outfitted as a recreational vehicle where it's a rolling hotel, it's a rolling clinic, where we can go to Skid Row, for example, and set up a clinic for a day. Or we could go to a Head Start or a WIC center where there's young moms that are struggling to find resources to get their kids care or even food for that matter, and set up a clinic on the spot. We have 2 of them, one that's focused on dentistry and another one that's focused on preventive health. Actively pursuing a grant right now with our HIV department, in which we'll get one where we'll go out and do mobile testing and preventive education, handing out prophylactic resources, prophylactic medication. Our goal within HIV is one day to eliminate the HIV epidemic, doing everything we can to keep our communities healthy as long as we can. Yusuf, for example, a paramedic with 4 years of experience. You're looking at a former paramedic. Harold, what I would recommend, Harold, are you interested in a clinical track or an administrative track? I'm assuming administrative because you're in the healthcare administration program. Is that accurate? Let me go down the chat. You'd say clinical? And was it when you became a paramedic, was it what was the part that appealed to you the most? Most people that have an ER or a paramedic type background, and I'll tell you, operational executives probably share this common trait, is we all have a little bit of ADD. We get bored doing the same thing from 1 minute to the next. And in an emergency room setting or as a paramedic, you're doing something different. You never know, one day is different than the other. So if you're thinking something along the clinical lines, Harold, I would recommend a career in nursing and focusing on emergency medicine. You're going to see everything and anything under the sun. But the really cool part about nursing is if you get tired of the 12-hour shifts after a while, you can switch to a career in teaching. You can switch to a career in leadership. You can work for an insurance carrier or something along those lines. Christina, what are some of the challenges that the organization had to overcome during the pandemic? I can tell, we could talk about this for probably about an hour. Quite a few. If you think about the first thing that came to mind for us was we imagined that it was going to spread and spread quickly, and our clinics were going to be overrun. Specifically, the hospitals would be so full that patients would be coming to the clinics. But when the first surge happened, the exact opposite happened. People were scared to go to the hospitals. People were scared to go to clinics. And business units like the dental one that I oversee had to completely close down. So it was us strategically thinking how we can continue to deliver on our mission, how we can continue to drive. And what we did is we opened up testing centers. We set up over 12 of them throughout LA and Orange County, where we were doing sometimes 100,000, anywhere from 1,000 to 10,000 tests in a given day at any one of the given centers. So being able to pivot and meet your community needs, I think was one of the strongest things that kept healthcare organizations sustainable throughout the pandemic. Then when immunizations came into the equation, being able to meet the demand on that part and getting as many people immunized as we possibly can, that part shifted as well, where now we're trying to convince the folks or influence the folks who haven't been immunized to become immunized. Personal decision that everybody makes, but ultimately we're all in this together. Ruan, is there a way we can get your email so if we have more questions later on? Absolutely, yes. I'm going to type it in the chat right now, so no one has to write it down. Oops, I think I accidentally sent it only to Josie. Let me try that one more time. Everybody see my email? Awesome. Okay, I see another question. Josie, thank you for all the information. Does John Warda still work for you at AltaMed? John's a good friend of mine. We still keep in touch. Unfortunately, he's no longer with AltaMed. He went to Glendale Adventist, and he's our special events director. But when I see or talk to John next, I will definitely let him know that you said hello. Did you used to work with him at Kaiser? That's what I thought. Yeah, John's a great guy. We have quite a few Kaiser alum at AltaMed that are very, very mission aligned and helping us become as Kaiser-like as we possibly can. All right, any other questions? Do I have a LinkedIn? I'm going to be honest with you. I took it down about 6 years ago, and I'm going to tell you why. I would get probably 2 calls a week from recruiters trying to recruit me away from AltaMed. I am committed enough to our mission where I plan on retiring with AltaMed, and maybe not fully retiring. I plan on teaching sometime within the next 7 to 8 years. But I do not have a LinkedIn account just because the headhunters are relentless. If I could figure out how to hide my LinkedIn account where I could only give it to folks like yourselves, I would gladly do that. But you have my email address, and you're I'm more than glad to stay in touch with you that way. Harold, I see your other question. I used to work the 7 to 7 shift. Those are rough. At some point, I didn't feel I was doing a difference on one-on-one encounters. I'll be sure to research the administration side more. I think that's a good approach. I think that's a good approach. All right. Any other questions? If you could give us advice on how to succeed in healthcare, it would be, I'm assuming, great. I will tell you advice that I could give you in any service-based industry is what distinguishes a long-term sustainable leader ultimately is integrity. You're only as good as the word that you keep and the promises that you deliver on. It's hard to earn trust, it's hard to earn respect, but it's real easy to lose. So always be true to your word, always deliver on your commitments and promises that you make to staff, because they never forget. They never ever forget. The other thing is focus on integrity-based relationships and surrounding yourself with people that are focused on integrity. I can't say that word enough. Every member of my team is an integrity-based leader that is service-oriented, that is humble, but relentless in their pursuit for excellence. Another Jim Collins quote. So be relentless, be humble, and be true. Thank you, Jose.
Thank you so much from all
Sorry
of us.
we couldn't get
Really
the sound to
interesting.
work. I hope it's working on your end. Hope you can hear each other. My pleasure, he said. All right, thank you, everybody. I'm taking the flood of thank yous as I'd like to thank each and every one of you for your time, for your attention. Hope to meet you all one day in person. We're getting closer and closer to that. Thank you. Thank you, Juan. And if you're interested in internships within AltaMed, don't hesitate to, I believe Dr. Brenda Freshman is running those right now. If you work through her, she can help place you in. That's right, Jose, correct?
Correct.
Awesome. Thank you, everybody, for your time. It was a pleasure spending time with you, and I look forward to seeing you soon again. Take care. Bye-bye.
Dr. Martinez, for the extra credit, will you be gaining the sheet from the host?
Yes, I will. Let's see.